Welcome to The Explainer. You know, when we look at healthcare, we all know the stakes are just incredibly high. But as we dig into this material, a really surprising paradox emerges. You can literally have the most skilled clinicians in the world, physicians who are absolutely excellent, nurse practitioners who are deeply caring, therapists who genuinely change lives, and yet they can still end up permanently closing their practice doors. So how does that even happen?
Well, let's dive right into this. Most medical practices do not fail because of bad medicine. They fail because of bad operations. Now, that is a pretty shocking hook, isn't it? The data actually highlights real-world cases where doctors are seeing, say, 30 patients a day, they have a completely packed waiting room, and yet they still miss payroll. It's definitely not a lack of patient demand. It happens because, for example, 40% of their claims are being denied, nobody is following up on them, and the money just evaporates.
This creates a fascinating, deep divide between clinical care and operations. You've got the what, and that's the clinical care, right? The one-on-one diagnosis, the therapy, the prescriptions. But then you have the how, which is the healthcare operations. Operations is what actually allows you to deliver that exact same care to hundreds of patients, consistently, day after day, without the whole thing collapsing. It's the literal difference between a highly talented individual and a functioning, financially sustainable organization.
So here is our roadmap for this explainer. 1. The real reason practices fail. 2. Dropping the patient baton. 3. Where the money leaks. 4. Building the invisible engine. And 5. Preventing future failures. All right, let's get started.
Section 1. The real reason practices fail, and why the workflow is patient safety. We often tend to separate clinical outcomes from administrative tasks, right? But the truth is, when operations fail, it's a clinical issue. If a psychiatric patient goes 10 days without their medication just because of a paperwork delay, that is an actual clinical failure. We really need a critical mindset shift here. Stop thinking of operations as just boring administrative paperwork. It is the invisible engine protecting your patients and your profits. Think about the people working in the practice for a second. When your front desk staff quits every few weeks, they aren't burning out because the work itself is intrinsically too hard. No, they're burning out from the absolute chaos of missing processes. If there are no clear procedures, everything becomes a sudden emergency. And well, that's exactly when a system breaks down.
Section 2. Dropping the patient baton, the 11-stage relay race.
The single best way to understand operations is to just follow one patient all the way through the practice. You see, the patient journey isn't a single event, it's a relay race. Weeks before a visit, we have discovery and scheduling. Then 72 hours before, there's insurance verification. The day of includes intake, the actual care, and clinical documentation. 48 hours after requires charge capture. And finally, weeks after deals with claims, denials, and patient retention. Let's really see how this all builds together. Care fails not because one runner is slow, but because the baton gets dropped during these handoffs between departments. A failure at any single point on this timeline doesn't just stay isolated, it ripples through the entire system.
Here's a perfect, albeit incredibly painful, example of a dropped baton. In healthcare billing, literally a single misspelled name at the front desk will bounce a perfectly clean claim weeks later. A typo becomes an absolute tragedy. Think about the handoffs at registration and documentation. If a front desk worker mistypes an insurance ID by just one digit, that claim dies down the line. And on the clinical side, if a provider finishes a visit but doesn't properly document it in the chart, legally and financially, it simply didn't happen, and you definitely can't bill for it.
Section 3. Where the money leaks, the silent revenue cycle.
To really understand this, we have to distinguish between billing, which is just, entering codes and submitting claims, and the actual revenue cycle, which is the entire journey of a dollar. So I want to pose this question. Why do busy practices still run out of money? It's honestly one of the most agonizing pain points for an owner to look out at a completely full waiting room, feel absolutely exhausted at the end of the day, and still look down at an empty bank account.
So the crucial point is that the money is usually leaking silently in 3 specific places: unverified insurance eligibility, missed clinical charges, and unworked claim denials. Skipping insurance verification 48 to 72 hours before a visit is arguably the single most expensive skip step in healthcare. You provide the care, submit the claim, and only then discover their plan was terminated or, they needed a referral. Now you're stuck chasing money that will probably never arrive.
Section 4. Building the invisible engine, fixing the fundamentals.
To plug those leaks permanently, we have to build operational building blocks, and they're anchored on this core concept. If everyone is responsible, no one is responsible. When a clinic just assumes, oh, we're a team, we all pitch in to handle denied claims, What actually happens is that those claims sit completely untouched because everyone just assumes someone else is doing it. That ambiguous ownership is exactly where the baton gets dropped.
Let's walk through the 3 steps to fix this. Step 1. Clear ownership. You need exactly one owner per task. Step 2. Written process. Build standard operating procedures, or SOPs, starting with your top 5 most repeated tasks. Step 3. Honest measurement. Track your baseline numbers. Turning knowledge from one person's head into a written SOP completely stabilizes a chaotic clinic. Think about it. If losing one key employee would cause your entire front office to literally shut down, you don't have a staffing problem. You have a process problem.
And this brilliantly illustrates how to handle that third step of honest measurement. We can categorize our key performance indicators, or KPIs. Access in front office tracks things like the no-show rate and verification accuracy. Revenue cycle tracks the claims denial rate and days in accounts receivable. And experience looks at patient satisfaction and employee turnover. My biggest piece of advice here: do not drown in data. Just pick a small dashboard of 5 to 7 of these KPIs and review them regularly. A few numbers watched consistently will absolutely always beat 50 numbers watched never.
Section 5. Preventing future failures. Preparing for AI and automation.
Mastering those basic fundamentals is actually the mandatory prerequisite for adopting any of the exciting future healthcare trends, because there is a massive difference between fixing a process and automating a bad workflow. Buying expensive technology or AI to fix a fundamentally broken practice is a huge mistake. Software just amplifies whatever you already have in place, right? So automate a bad workflow and you simply produce bad results much, much faster.
Which brings us to our final takeaway. If your operational fundamentals are broken, no amount of AI is going to save you. Are your systems resilient enough for tomorrow? I really want to leave you pondering that question about your own practice's resilience. Getting the basics right first, the ownership, the written processes, the measurements, is what prepares you for whatever comes next. Good operations are the invisible engine that turns clinical excellence into sustainable success. Thank you so much for joining me for this explainer. Keep focusing on those fundamentals, and I'll catch you next time.